Greetings. My name is Dr. Richard Brown. I'm a PhD and fellow in the American College of Healthcare Executives, and I'm president of Lee Brown and Associates. This is a healthcare management consulting business. I've done that since I retired about 6-7 years ago, and I always tell people these days that I am retired, admired, and can't be fired. So my career spans over 35 years of administration experiences in a variety of health services organizations, both private and nonprofit, and I've been serving the vulnerable population for all of my adult life. I'm a seasoned administrator. I have proven leadership and organizational skills. I've actually been awarded service awards for Healthcare Management of the Year back in 2006 by the National Association of Health Services Executives. Creighton University awarded me the John Slagle Award for Excellence in Innovation. So additionally, I've served about 10 years as an assistant or an adjunct professor at 4 different universities, teaching healthcare management, public health, all things health. And recently I've been involved with doing newsletters. I've done 42 newsletters on COVID-19. I've done 52 blogs way in the past on wellness in Nebraska. And now I'm involved in this venture called the podcast. But before I go into that, I am an author. I've written a chapter called Long-Term Care in one book, but most recently, I'm a co-author of a book called Mission Unstoppable. This is a book that everyone should have, Mission Unstoppable. It is the brainchild of George Fraser, who's a network guru and a person who's spent most of his adult life helping Blacks to achieve wealth. Also, Les Brown is the second author here, who's a motivational speaker, world-renowned. Well, these two guys decided to pick 31 people throughout the country who had had success in their businesses and in their life, and talk about how they got there. They talk about the dark days, the valleys, the stumbling blocks that they had, and they put it all together in this book called Mission Unstoppable. And my chapter is on the experiences that I've had as a healthcare administration, and it's called Maximize Greatness. Maximize your greatness, okay? So you can obtain this book through going to my website, which is www.leebrownandassociates.com, or you can email me at richardlb67@yahoo.com, and I will send you a book, autographed copy. So moving along as to allowing you to know who I am, I have a bachelor's degree in sociology from Missouri University in St. Louis. I have a master's degree in hospital and healthcare administration from St. Louis University, and an earned doctorate in adult and continuing education from Florida State University. So I've also held membership in a variety of organizations, both locally and nationally, and I actually had a hole-in-one in 2010. I'm very proud of that. So my current role here and venture is this podcast. Now, the purpose of this podcast that I'll be involved in is going to focus on providing education and wellness on health and on healthcare and disparities. I'll also talk about the impact of health disparities on mental health as well as physical health. I'll discuss hot topics that involve people in Nebraska, the United States, and all over the world. I'll also provide recommendations for professional help that persons may need in the area of healthcare or mental health, and also refer you to certain readings that you might partake of for your own education. And I always provide some type of health tip because I think it's very important that we all should focus on our health every day, all day, because it's the most important thing that we should be doing with ourselves. So let me begin now by talking about the definition of health. Now, if I was in the classroom, I'd be asking my students to raise their hand and tell me what they think health is. And of course, I would get a lot of different answers. As I'm sure you're thinking about now, what health is, and you should think about that because you each have an understanding and a knowledge and some thoughts about what health is. Now, it is very different and varied, I'm sure. But one organization defines health as the freedom from disease or abnormality. Okay, freedom from disease or abnormality, a condition of optimal well-being, including mental, physical, and spiritual conditioning. Optimal well-being can be considered as to whether or not you're financially well off or you're economically well off or you have social situations in which you feel healthy about. So to be healthy is the most important condition that human beings can have. If you've got your health, then you have everything. You can do anything. The sky's the limit. The human being is an incredible animal. I think Dr. Martin Luther King mentioned it. The human being is an incredible animal. Humans can live at the equator at 110 degrees and also live at the North Pole at 40 degrees below zero. Isn't that amazing what this animal can do? And we're the only creatures on Earth who was given the ability to smile, okay? The only creatures on Earth that was given the ability to smile. You don't see a horse smiling or a dog smiling or a cat smiling. If you do, let me know. We can get rich on that one. But you might hear a hyena in the jungle who might be sounding like he's laughing, but I guarantee you he's not smiling. It's probably a mate call of some sort. So let's talk about now health disparities. So the US government defines health disparities such that it's a term that refers to the difference in health and healthcare access among members of different populations. So key word is difference among populations. So there's gaps or inequities that can be connected to race, ethnicity, gender, sexuality, socioeconomic status, geographic location, and other categories. The Institute of Health, National Institute of Health, defines health disparities as differences in the incidence, prevalence, mortality, and burden of disease and other adverse health conditions that exist among specific populations in the United States. Again, the word difference is a key word. Disparities has to do with differences. Another organization, the Office of Minority Health, defines it such that it is the differences in health outcomes that are closely linked with social, economic, and environmental disadvantage. Again, differences, disadvantage, economics, environmental circumstances are all part of the definition and meaning of health disparities. And then finally, the World Health Organization, who you've heard lots about, defines health inequities such that it considers the unnecessary, avoidable, and unfair, unjust situations between people. So when you think about the word unfair and unnecessary and can be avoidable, then of course that means that it can be changed, right? So it doesn't have to exist. It can be eliminated. Yes, maybe so. Historically, these characteristics have been linked to discrimination and exclusion. Okay, so that's beginning to see a key clue as to why these things exist. Discrimination, exclusion. So when a particular group of people doesn't have the same kind of access to healthcare, education, or health behaviors, it can cause them to fall behind their peers and all kinds of other healthcare measures. So these disparities can persist for generations. So you see certain races seem to fall into the same pattern generation after generation. That's just the way it goes because of the conditions and the reasons that causes these situations. So I want to talk briefly about some examples of health disparities, just a few today. So health disparities exist all over the world, including the United States, and affect every age, race, ethnicity, and sex. Let's look at a few examples. Infant mortality. You've heard a lot about that. Babies born to Black women in the United States die at a more than double the rate of babies born to white women. Why? Why? Is there something innate different between white women and Black women just because they're black or white that creates the situation where you get infant mortality? Well, we'll talk about that. Dementia. This is another area where there's a great disparity. Black people also have the highest risk of dementia and are twice as likely to develop Alzheimer's disease than whites in the United States. Why? Why is this happening? Another one, cancer. Cancer is the third leading cause of death. People with low incomes and education levels are more likely to get cancer and to die from it compared to their more affluent peers. And this gap appears to be widening. So we're all living the same United States, and we're all eating the same kind of food and getting education and this, that, and other. Why are some people getting cancer and some people don't? Well, maybe we are not eating the same kinds of food or living in the same areas or getting the same education. Perhaps that's a clue to why we have these disparities. Obesity is the next one. Even after controlling for family income, rates of obesity in Black women and Mexican American men are substantially higher than other races or ethnic groups. Why is this? I used to wonder about this a lot. Why is it that people who are poor, don't have a lot of money, at the lower income brackets, how come they're obese? I mean, you would think they would be thin because they don't have enough money to buy enough food so that they become obese. Well, that's not the correct thinking, because the type of food that you eat is important, and access to food is important, and access to recreation and access to physical activity and other situations that contribute to why we have an obesity problem in the United States. And of course, there's more obesity in the Midwest than there is in I see the West and East. I think about California, where you go to a restaurant in California and you get these small meals, very small. You go to a restaurant, say in the Midwest, and they give you triple helpings of whatever it is you're eating. So I've always told people that they should, in controlling their eating habits, they should focus on eating meals that are about the size of a deck of cards. Okay, no more of a serving than a size of a deck of cards. If you just do that, you can do something about the obesity. Next is smoking. Smoking. Native American, Alaska Native men and women have disproportionately higher rates of smoking, as do individuals living below the federal poverty level and those who are unemployed. Okay, so why is it that people who have a lower income and less access to maybe some money, why are they spending these dollars on smoking? And I've never smoked. I don't know how much a pack of cigarette costs, but I think it's maybe $5 or $6 a pack, could be more. So why does this exist? Well, we're going to explore some of that in the future. Lastly, for today, I want to talk about binge drinking. So binge drinking is considered when a person takes 5 drinks in a 2-hour period. That's binge drinking. So who do you think binge drinking takes place with the most? Is it whites, Blacks, African Americans, Indians, Mexican Americans? Who is it? Well, according to the latest research and data, it is young white men are more likely than other groups to binge drink. So like many aspects of public health, the root cause of health disparities are complex. Health is influenced by so many factors that it can be different and difficult to pinpoint just why a gap between two groups is so wide. That said, disparities are often the result of health inequities, and that's very important. Health inequities is one of the clues to why there's such disparities. That is, the differences in how resources are distributed among different groups. We know that resources are not distributed against or among groups equally. I think about the COVID-19 crisis that we were in, and that we continue to be in. The vaccine rolled out to certain groups, but didn't roll out to other groups. It wasn't done all at the same time. So we know that resources are not distributed equally among all groups. These resources could be like the parks and jobs and access to healthcare. There's a lot of different resources that exist, and we're the richest country on this planet, they say, but the resources are being distributed differently. And so the distribution of the resources causes some of this disparities when they're distributed unequally. So in the future, we're going to talk about some specific causes and reasons why there is such a health disparity, especially in the United States, but also in the world. And we'll focus on environmental factors, quality education, criminal justice system, healthcare access. But for now, I'm going to end this podcast by making sure that everyone who's able to and eligible for a vaccine should take it. The vaccine is safe and effective and is here to protect us. And then there's some people who say, God will protect me. Well, he has protected you. Matter of fact, he invented the scientists who invented the vaccine, who made it out there and made it available for everybody. So it's now time for you to do your part. So please get the vaccine. The virus is real. Its only mission is to kill. Thank you very much. This is Dr. Richard Brown, and this is Health and All Things Health. Thank you very much.